anterior cruciate ligament is one of the four main stabilizing ligaments in the knee. There are two within the joint, the cruciate ligaments, obviously the anterior and the posterior, and the collateral ligaments with the medial and the lateral collateral ligament of the knee. And they play a key role in stabilizing the knee joint in addition to the muscular factors. An ACL is ruptured when the knee excessively twists or excessively bends in one particular direction. And in essence, it either tears the ligament away from the bone or tears the ligament itself. In terms of the diagnosis, it's very important to understand that an early diagnosis here is really important, because there are associated injuries that can go with an anterior cruciate ligament rupture. You can have injuries to the joint surface itself, and you can have injuries to the meniscus within the knee as well, which can be repaired if we get them early enough. A specialist can often make the diagnosis purely on the history of the mechanism of injury. This is supplemented by an examination, and there's a typical laxity that the knee will show you when there is an ACL rupture. This is often supplemented with an MRI scan, which of course is becoming increasingly common these days. The reconstruction is the replacement of the old ligament. Now, when you replace the old ligament, this is done arthroscopically through keyhole surgery, and the vast majority of operations these days on ACLs are done arthroscopically. What you need is you need to remove the old graft from within the knee, but maintaining evidence of the footprints, the attachments to the bones top and bottom, because that's exactly where you're going to put the new graft. We're looking for a bit of yourself, if you like, to replace the ligament with. Historically, the more common graft we used was a section of the patellar tendon on the front of the knee. But these days, the more common operation is to use the hamstring tendons from the back of the leg. Following an ACL reconstruction, you'll leave hospital the same day with crutches, and in theory you can fully weight bear on the leg. But because you've had a knee operation, often the quadriceps and other muscles are not working effectively, so you need to have crutches for probably a week or 10 days until they regain your security and strength. I think when you have an ACL injury, it's important to understand this is often a complex injury involving the whole joint and not just the ligament itself. And potentially 50% of people who have an ACL rupture have other associated injuries inside the knee, typically the tear in the meniscus. And as previously mentioned, a meniscal tear, if caught early enough and appropriate, can be repaired. And this is important for the longer term benefits, hopefully, of that knee. Because it's such an extensive injury to the joint, it's known that 30 or 40% of people who experience an ACL rupture will get some degenerative change or early arthritis in the knee at about 10 or 15 years. Now, that occurs irrespective of whether or not the knee is reconstructed, stabilized, or not. So we're not exactly sure what underlies this. All we know right now is that we think the best situation for us to achieve surgically is to stabilize the knee and repair those damaged structures within the knee as early as we possibly can.